Primary care doctors are now being encouraged to screen all patients for depression. Statistics show about 7% of all U.S. adults experience depression every year. News 8's Brittany Schmidt joins us now in our studio with a closer look at those new recommendations.
Mike, the U.S. Preventive Services Task Force made the recommendation earlier this week. Along with asking primary doctors to screen for depression, for the first time ever, the government-appointed health panel is also asking doctors to screen for depression during pregnancy and after giving birth. And it's a movement health professionals in our area have already been a part of.
It can really impact a lot of areas in people's lives.
When you head in for your yearly checkup with your primary physician, you're often asked questions about your physical health. Do you have allergies? How often do you exercise? Do you have trouble breathing? But how often are you asked about your mental health?
How's your mood been lately? Or how do you think things have been going in your life lately?
If the answer is rarely, that's about to change. A new recommendation by a highly respected health panel is now encouraging all primary care doctors to screen their patients for depression.
I think as behavioral health providers, we've known that depression is a problem and should be better assessed. I think that hospitals and institutions are learning more about how this impacts people not only emotionally but physically. And so that's where this push is coming from.
For a while now, when a patient goes to Gundersen Health System, they've been asked to fill out a questionnaire.
It's capturing over the past 2 weeks how frequently have you felt or experienced these symptoms.
Each category is numbered, and at the end, the numbers are added up.
When someone scores a 12 or above, then we should actually be taking some kind of action. When they have lower scores, but they're still saying it's interfering with their quality of life or how they're functioning, we're still going to address it and clinically respond to it. But this just gives us kind of a flag that says you should be looking at this.
Cobal says depression is not an easy thing to talk about, and the earlier it is acknowledged, the better.
The more patients get asked about it, I think the more comfortable they feel talking about it too. It starts to feel so normal, it doesn't feel like it's a shameful thing to talk about anymore.
And the fact that we're addressing it when they come into primary care and we make it part of their normal care, I think that helps take away the stigma of having depression.
Now, one thing the task force did not make any recommendations for was how often someone should be screened for depression. They say it really depends on the patient and what the doctor thinks is best. However, they say probably once a year is a good place to start.
And now, does Mayo Clinic Health System do this depression screening as well?
They do. They also have kind of like the similar protocol where they'll have somebody fill out a questionnaire, and then depending on their answer, the doctor will figure out what's best moving forward.
Okay, thanks, Brittany.